Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Tara Narula. First up, a serious condition that could be triggered by eating gluten. Celiac disease is an autoimmune disorder that impacts both adults and children. It's estimated that a little less than 1% of American adults have celiac disease, but most cases go undetected.
This week, the U.S. Preventive Services Task Force issued their recommendation on the effectiveness of the screening process, as published in the Journal of the American Medical Association. So, Dr. LaPook, what did the task force conclude?
So I'm a gastroenterologist. I deal with this issue all the time. And here's the context of it. On the one hand, you have this condition, celiac disease, that affects a lot of people, and it can be very tough to diagnose. You can have obvious symptoms, but it can be very subtle. On the other hand, you've got a lot of people out there who are on these gluten-free diets who really don't have celiac. So should you be testing people who don't have any obvious symptoms? That was the big question. We've been waiting for this for years, and drum roll, they said, who knows? We do not have enough data, and it's something that has to be decided between the patient and the doctor. So that's why we're going to talk about it today, get a little bit more detail on it.
Tara, why is it so hard to diagnose?
So it can be tricky, just like Jon said, because it can masquerade as a lot of different things. You can have patients who have no symptoms, patients who have mild symptoms to severe symptoms to atypical symptoms. So the more common things would be abdominal pain, bloating, diarrhea, but you can also have symptoms like fatigue or neurologic symptoms or anemia or osteoporosis. So the problem is that it can take many years to diagnose people appropriately, and during that time, there can be damage happening to the small intestine.
So, Jon, okay, you mentioned this is your field of study. So what's the opinion of you and your colleagues on diagnosing and testing?
I think the bottom line here is that everybody, doctors too, have to have a much better level of suspicion about it. There are often pediatricians who notice that some kid may have a little bit of low iron or anemia and not really be aggressive. You should test that person for celiac because to see if maybe they're not absorbing their nutrients correctly. There are conditions like brain fog and learning disabilities that have been associated with celiac disease. And so if you have that, maybe that's somebody who should be tested. Why shouldn't everybody just go ahead and do a gluten-free diet? Well, it's a pain in the neck to do a gluten-free diet. Gluten is in everything. It's in soy sauce. It's in a ton of things. If you have French fries, that might not have gluten, but it was fried up in something where previously it was cross-contaminated with gluten because it was fried chicken, then you have to worry. So there's serological testing, there are blood tests. We need to do a lot better, a lot more research to figure out who should be tested and when. Bottom line here, high level of suspicion, doesn't have to be big time symptoms of diarrhea and abdominal pain, could be no symptoms or subtle symptoms.
Are there complications that can arise from celiac disease?
There can be. And so the evidence shows that it is associated with an increased mortality. And there are complications from malabsorption of certain nutrients. So you can develop anemia or bone fracture, some osteoporosis. It's also been associated with some neurological changes, as Jon mentioned, also reproductive and obstetric problems. And then in rarer cases, it's associated with lymphoma and other types of intestinal cancers.
Migraines, osteoporosis, short stature.
Everything.
There's a lot of things.
It's a big list.
All right, our next topic, watching your sugar intake. It is important for anyone's diet, but it can be even more consequential for those with health problems like metabolic syndrome, a group of health issues like high blood sugar and obesity that in turn can increase your chances of developing certain chronic illnesses like diabetes and cardiovascular disease. A recent study published in the European Journal of Nutrition referred to estimates showing nearly 35% of all American adults and half of those 60 and older suffered from metabolic syndrome in 2011 and 2012.
The study looked at a small group of patients who received some dietary counseling while following the American Heart Association's 2006 dietary guidelines and examined if this diet was effective in decreasing added sugar. Tara, what did this study show us?
Right. So I think it really speaks to the power of nutritional support and dietary counseling. And I tell a lot of my patients they should work with a nutritionist. I think that's why programs like Weight Watchers or Jenny Craig can be successful, because it gives people that added support. So in this study, there were 119 people who were given information about the AHA's diet, but also received individual and group counseling sessions over the course of a year. At the end of that year, they were able to decrease their added sugar by about 24 grams, which sounds great, and it is great. But the problem is that about 48% were still over the recommended amount, which for men is about 9 teaspoons a day or 36 grams of added sugar, and for women about 6 teaspoons a day or 24 grams of added sugar.
They sneak sugar into
Everything.
That's the thing.
Finally, time for some practical advice this week. The importance of knowing your family's medical history. Jon and Tara, just how far back do we need to go here?
Yeah, I think this is so important, and people don't give it a lot of the credit that it deserves. So many times I ask my patients, tell me about your mother and father or your brother and sister, and they have no idea. But especially in cardiovascular disease, it plays a big role in determining your risk for things like coronary artery disease, heart failure, electrical abnormalities. And it really helps us guide how we diagnose people, what tests we might order, and how we treat them preventively.
Yeah, and it's not just, people think about heart disease and cancer, but it's other things. It's gout, it's kidney stones, it's mental illness. There are all sorts of things that you can get clues at. And of course, one of the problems is that back then, people they weren't that open about their problems. So often somebody will come to me and they say, well, I don't really know. I think she had stomach cancer. Well, stomach cancer could be colon cancer, which would mean they have to get screened maybe earlier. So try to get as many details as you can.
Ask questions.
Yes.
Don't take no for an answer. All right, doctors Jon LaPook and Tara Narula, thanks.